father was a physician, so I think that was a big influence in terms of me wanting to go into medicine. I really loved seeing the relationship that he built with his patients and the way that he impacted their lives. It was not like anything else that I'd ever seen in any other profession, and so I think that really inspired me to move forward with medicine. As I went through my clinical rotations, I found that I really loved surgery, but I switched into surgery late, and one of my biggest concerns was, am I gonna even match at all? But I've had several mentors who were extremely helpful with that, and I just feel extremely supported by the surgical faculty here, and I'm very, very grateful for them. My family has been so instrumental in the kind of person that I've become. I visited them a lot during the start of my clinical rotations because I was actually split up with a good group of my friends during the start of clinical rotations. So when I started that, I felt like it was kind of hard to have a support system at that time. And then you're going into a different rotation almost every week. You're working in a different part of the hospital. Everything's very new. You're working with new teams. So it's a very dynamic and very anxiety-inducing process if you don't know how to adapt and work with it, because undoubtedly you will fail many times in your career. I've had struggles with several things in my medical school career, and that will continue to move into residency as well. But as long as I think the focus is on getting better and learning from your mistakes, there's nothing more than you can expect from yourself. So I matched at LSU New Orleans for general surgery, which I'm very, very excited about. I think the program is extremely strong in terms of operative experience and autonomy and getting into the OR. I really want to focus on being a very compassionate physician that does not give up on their patients, the doctor that will be there for them, the surgeon that will be there for them for whatever they need. I'm very grateful that I have had USF as the institution that I've been with for quite some time, and it's brought me some really, really great friendships, great relationships. It's brought me the opportunity to be a doctor, and so those are things that I can never thank USF enough for.